If you talk about diffuse large B-cell lymphoma, the highest unmet need there is patients that relapse. And after they were induced with rituximab-containing regimens, if they relapse rather early, we have no real effective retreatment. So I'm focusing on CD30, the CD30 molecule that is present on about 30% of initially diagnosed DLBCLs and also in the same fraction of patients that relapse. And we have a very active compound against CD30, the antibody-drug conjugate Brentuximab vedotin. So what we have been working on and still working on is in Hodgkin's lymphoma, where the reached Sternberg cells are CD30 positive. We are running a Transplant BRaVE study in Europe, where we combine in relapse or primary refractory patients Brentuximab vedotin with second-line chemotherapy, DHAP, with the aim to increase the PET-negative metabolic complete remissions in second-line treatment prior to high-dose chemotherapy and autologous transplant. The more PET-negative CRs you get prior to the high-dose treatment, the better the outcome will be in terms of cures. I strongly believe in that. So that study made it possible to combine full doses of Brentuximab vedotin with full doses of DHAP. And we got a tolerable toxicity profile. 12 out of 12 patients achieved a PET-negative CR, which is of course small numbers, but it's giving hope. And we are now transferring the same approach to CD30 positive relapsed DLBCL. So combine Brentuximab vedotin with DHAP, see whether we can increase PET negativity prior to high-dose chemotherapy and autologous transplantation. So for 30% of patients in relapse, this might, let's say, induce somewhat more cures because their prognosis is dreadful. So that was also discussed at this meeting, CD30, Brentuximab vedotin, and other compounds that are out there. So I think there's a bright future in really targeting the cancer cell with these elegant antibody-drug conjugates.